Welcome, everybody, to what will be episode 220 on our CX-CC YouTube channel, Customer Experience, Customer Centricity. I'm your hostess, Debbie Levitt from Delta CX, and welcome to another from the My Job series, where we're going to learn more about people's day-to-day jobs, because maybe it's a job you might want to do, or maybe your coworker does this and you don't understand what they do, and you don't want to ask because you feel embarrassed. So this show is for you. But before we get started, let's give a quick thanks, as always, to our paid Patreon members. We also thank our not paid Patreon members. If you'd like to join the Patreon for free or not free, check it out at patreon.com/CXCC. There's extra content there. You get stuff weeks earlier than everybody else. And so if that's for you, you can join starting at $1 American a month. Totally optional. So thanks for the support. So today's adventure is about healthcare UX and behavior change. So thanks to Dr. Gyles for putting this and our next show together. Thank you so much for coordinating all of this. So then, Dr. Gyles, let's start with you. Who the heck are you?
Hi everyone, I'm Gyles. I wasn't born with my medical degree, so I'm happy to just be called Gyles. But yeah, I work as a clinical UX strategist. I've been in this field now for, it's been about a decade now. And I specifically work on the experiences that clinicians and patients have. You can't obviously design experience, but that's the area of focus for me. And yeah, prior to that, I worked as a medical doctor for 3 years.
Cool, thank you. Cherish, tell us about you.
Hi everyone. Yeah, my name is Cherish Boxall. I come from a different aspect on this. So I work in academia at the University of Southampton, which means we have slightly different terminology, but there's a lot of transferable skills between UX and what we call trial conduct methodologists. We've got to have an extra long name, you see. But essentially, it's the same thing as Gyles. We really want to understand how to make taking part in research, health and care research, as easy and enjoyable as possible.
Awesome. Jack, tell us your short story.
Sure. Hi, everyone. I'm Jack Burton. I'm a UX researcher, so I specialize principally in understanding human behavior and the interactions that people have with digital health solutions, obviously to make them more people-centered, more user-centered, and improve the experience of those. The kind of route for me into digital health within UX and clinical UX is really started off within psychology. So studied psychology, health psychology, did some formal training with none other actually than Gyles on the call with us today through the Clinical UX Association. And I now work for Kanos, mostly on public sector projects, but previously have worked in the past for pharmaceutical companies working on their digital products and services. So that's me in a nutshell.
Awesome. Thanks to all of you. I want to start with the easy, hard question, which is tell us a little bit about a day-to-day or week-to-week type of thing. You know, for people who are not familiar with the work you do, what might you do in a typical week? I'll start with Cherish.
Yeah, so a lot of my work is qualitative. So I work on projects lasting anywhere from 6 months to 5 years, which I understand can be quite a lot longer than some of the more typical UX research projects. My week to week really consists of talking to people. It's the best job ever. I get to understand what some pain points are, what problems have, what challenges, and I talk to people to try and find solutions. And then the next step is, can I test that solution? Does it work? So that's kind of that. So talking to people, so you've got the administrative side of that as well, calling up, tracking things, understanding what incentivizes people to share that. Generally, it's quite altruistic. People take part in interviews because they want to help other people. So that's a great part of my job as well, is people want to do, want to help make solutions. So yeah, I can be more specific, but that's essentially it.
Okay, thanks. And Gyles, what about you? Week to week or day to day, as specific as you want to get?
Probably week to week is a bit easier. So because I've been in the field for a while, obviously you'll start out making sure that you're good at being a good UX professional, research methods, design methods, following the process, knowing what constraints you should say no to, what constraints you're willing to accept to get the job done. So now that I've grown a bit, my work falls within 3 broad categories of more diagnostic work, strategic work, or educational. So under diagnostic, it would be that I'm working with clients and specifically understanding the problems that they have and help them create a plan that's going to solve it. That goes more into the strategic side as well, where it means forming a team, actually enforcing what that plan looks like for them. Does it mean that they have to increase the amount of research that they have to do, the research that they're doing? What constraints means that we have to pivot how we're doing it so that it's actually effective and delivering on their needs? And then the educational side, which I suppose is somewhat strategic as well, is actually training people to work in my field. Working in a regulated area such as healthcare is very, very complicated. There's plenty of great UX work that can be done in healthcare if you've never worked in healthcare before, partly because just the whole concept and process of human-centered design, people-centered design, user-centered design, whatever you want to call it, it is supposed to make problems be solved or improve situations. But I find that when you're working in such a regulated area, there's so much knowledge of just what are different diseases, how clinicians treat patients, and crucially, the laws and regulations that are at play that you have to adhere to. So I try to train up people in that field so that they can hit the ground running, I like to say. Sorry, hit the ground jogging, because you can't hit the ground running. There's always something to learn, but having that additional knowledge puts you at a little bit more of an advantage to work on these complicated projects and see light at the end of the tunnel and actually achieve a result. But I think prior to going into more of this senior work, it is very much what anybody working in UX would be doing. If you're more on the research side, the various research methods, the design side, whether it's service design, UX design, UI design, it's still the same. It's really that additional knowledge of medicine, of healthcare, disease, healthcare economics, and like I mentioned, ethics, law, regulation, and the like.
Sorry. By the way, we've had Gyles on our shows before in our other YouTube channel, Delta CX. So I'm sure if you go to YouTube and you type in Delta CX Gyles Morrison, a couple of things might pop up. So catch more of him back in the archives. Jack, what about you? A little bit of your week-to-week type of work?
Sure. Yeah. So in my kind of intro passage, I said that my role as a user researcher is really around understanding the human behavior around kind of problem spaces within healthcare, and also understanding how people are interacting with healthcare products and services. I think in reality, my role is actually to help my teams understand those kind of areas and help them make product decisions and service design decisions based on the insights that I'm able to generate through my research. So that's exactly what I do on a week-to-week basis. It really is dependent on the stage of the product that we're in or the stage of the service that we're in from a design perspective. So for example, as kind of Cherish mentioned, a lot of the stuff that I've been doing recently has been qualitative research. So actually speaking to kind of citizens, patients that may be using this healthcare solution that we're working on, and understanding what their needs are, their pain points, some of the challenges they're coming up against, and actually kind of how we might design this service that we're working on, which has many digital components, is very, very complex, and is quite intertwined with a lot of existing healthcare systems, and understanding, well, okay, how do we actually make it as user-centered as we can make it? Kind of qualitative work isn't the kind of all that we do as kind of researchers, of course, but as Cherish mentioned, it's really one of the more rewarding parts, I think, in my opinion anyway. Get the chance to kind of sit down with people from all walks of life, have some really interesting conversations to listen to their stories, which is always quite humbling, but really, really enjoyable and kind of enriches my life outside of work as well. So we do a lot of that, but ultimately my role revolves around how can I help my team get to the decision that we need to make, basically, and make sure that that's anchored in evidence that we can generate from research with real target users or anybody that's affected by the product or service that we're working on. So yeah, that's a little bit about what I get up to on a week to week.
Yeah, I love hearing about that because to me, that is what it's all about. And in some of these My Job shows, we've had questions from the audience asking, like, how do you collaborate with some of your coworkers? But hearing what you've all been saying so far, I want to turn that a little bit and say, you're all basically mentioning strategic work. You're talking about helping others make good or better decisions or trying to influence better product or service or clinician or patient decisions. Can we bring those together and say, can you each talk a little bit about how you might collaborate with teammates or stakeholders or others to be more strategic and help them make decisions? I know that was a lot of questions rolled into one. This is not a UX research session, y'all. Do not judge my research skills from that wacky question. Let me start with, we'll go a little reverse. Jack, can we start with you on a little bit more, if you can speak to how you help teams make better decisions?
Sure. So just I'll kind of talk through it from my own perspective and the projects that I'm working on. As I mentioned, I'm working quite heavily in the public sector at the moment. So on kind of digital pathways for national kind of care programs in England, let's say. Naturally within that and with the organisations that we're working with, because I work on the kind of consultancy agency side, there's a lot of stakeholders involved. We obviously have our own kind of project design and development teams. These are agile teams, very, very close collaboration. So I won't go kind of into the workings of agile, but we're on a day-to-day basis closely collaborating through kind of Scrum methodology, kind of what's going on, how's it going on, blockers, etc. So that's kind of set within our own internal teams. On top of that, of course, because there are a lot of stakeholders involved in these kind of healthcare solutions and these healthcare programs, we're then having to understand kind of how we can work with them to get what we need in terms of being able to turn design development into reality, the interoperability of systems that we're working with. We have input from kind of individuals, and this is kind of more specific to healthcare. We obviously have to make sure that we're getting input from clinical staff. We need to make sure that we're getting input from kind of regulatory and compliance staff as well, and colleagues. So it really does take quite close collaboration. I think, and we'll probably go on to this, but that is also one of the challenges as well of working within healthcare and in digital health, is that because there are, and there needs to be, because we're dealing with patient safety ultimately, but there's quite heavy kind of regulations and constraints. This can slow things down often. So you really need to have your collaboration, your ways of working, and your kind of communication as open as it can be. Naturally, you're still going to come into some kind of, what's the right word to put it? Time sludge sometimes, just where you can't get through to the right people, you can't get time with the right people, and it's just about managing that the best you can, so we're not kind of funneling all the stuff to the end of the project. That was a long way of saying, yeah, it's a lot of collaboration needed, as with kind of, you know, most roles within UX, but particularly within digital health, where you have maybe more stakeholders from kind of different areas to consider as well.
And I wanted to turn to Cherish next, and then let Gyles hit the home run, as we say. So, Cherish, anything you want to add to that about collaborating and helping people make great decisions?
Yeah, it's interesting. I think for me, from my perspective, it's about helping trialist design research that essentially helps with their recruitment and retention, and that's done by improving the participant experience generally. And the way that we do that is a huge effort. Like Jack said, there's so many stakeholders involved in these things, and there's lots of different methods of communication and different needs from those stakeholders as well. So it's all about pivoting your communications. From an academic perspective, of course, we do a lot of manuscripts that go into journals and different conferences, as many of us go to. But as well as that, we'll end up doing quite text-heavy funder reports as well. That's generally how they like to communicate, quite text-heavy, usually asynchronous messaging. So we say something, they say something. And we'll also, as Gyles touched on, there's a lot of regulatory authorities involved as well. So they like to know what's going on. And there's different ways of disseminating it. I do try and make an effort to go a bit above and beyond and make the collaboration wider. You know, we're not just working with our immediate stakeholders. It's supposed to be bettering society. So trying to get better at spreading that message. Recently, this morning, just launched my first online web resource, which hopefully will help. It's that sort of thing to try and disseminate, collaborate a little bit wider as well. So yeah, lots of stakeholders, lots of different methods of communication.
Right, so there's quite a few thoughts that come to mind to this. The first one is actually, I'm sure we've probably all heard of it before, and if you haven't, it may change your life. The book by Dale Carnegie, How to Win Friends and Influence People. I think the advice in that book is really, really useful. When you are dealing with stakeholders, particularly in healthcare, especially, to be blunt, people that are very wealthy, been very successful by whatever measure of success, very senior, you have to have a particular way of dealing with them if you want to get a result that is best useful for users. It doesn't mean that very senior stakeholders aren't interested in doing what's best for users. It's just unfortunately that might not be their first priority. They need to recognize how supporting you in your efforts on doing great user experience, customer experience work is going to help their objectives. So it's on the onus of me to understand what motivates them, what's driving their behavior, not just dissimilar to what I'm doing when I'm creating a digital solution, with many digital solutions for patients in particular and clinicians. I have to understand what is motivating them, what's driving them, what's putting them off, what's making them hesitant, what's making them fearful. Their emotions are important, particularly when we're talking about someone doing something which could lead to a diagnosis that they're afraid of and they're putting it off. So back to the stakeholders though, that whole understanding what motivates them, what drives them is key. The other thing to keep in mind with this is that a lot of my work, because of it being in I don't really want to, yeah, I will say it's an emerging field. UX less so. UX has been around in some format for ages, but I think this much more developed expertise for UX in healthcare is more emerging. That's why I call it clinical UX, to make it a bit more distinct, to highlight you've got to know about healthcare, ethics, law, regulation to do the job. And because of it being more emerging and even pioneering, there are trends, there is understanding that you have to have, and for the lack of a better word, evangelize to others. So where I can see that there's a variety of problems, blind spots, issues that are not being addressed, I have to present these in such a way that solving those problems is going to tie in with the work that the stakeholders are doing. So if a business is making a new digital therapeutic, but they fail to realize that there's a whole raft of patient users who are being excluded, who genuinely should be utilizing this product, whether it's finances, whether it's access, whether it's they just didn't even know that the product existed. My job is to make the client, those stakeholders aware that actually they're a set of people that you need to be accommodating, that they would not have been accommodating unless I had spoken up about that. So combating that wider issue of healthcare inequality is a massive topic for me. And so that ties in with a lot of my stakeholder engagement efforts. And indeed, as I mentioned before, the diagnostic work I do, the general strategic work I do, and indeed the educational work too.
Yeah, thank you for that. And we're starting to get some questions in the chat, so I may take these out of order. But let's start with new friend Trisha, who disclosed that Trisha works with Jack, and said Trisha is interested to hear how the people on the panel balance policy, product, and legal stakeholder asks with genuinely user-centered services and products. Anybody want to start with that one? Who wants to jump in?
Yeah, I can go with that one.
Okay.
So the only reason why, in my opinion, and I'm keen to hear what others have to say, the only thing that makes it challenging to deal with the laws and the regulation is that it's just quite complicated. It's complicated because there's no universal standard for this worldwide, even though, for example, the regulation of software or physical medical devices in healthcare, it's mainly the FDA in the US and EU medical device regulation are the main sources of truth and authority on regulation around the world, and other regulations and regulatory bodies stem from those. But even still, there are nuances. There's going to be something unique. So it's recognizing and adhering to those differences on a global level. And also, these documents are really long and really academically written. Like I've graduated from medical school. I've done a master's as well. I really hate academic reading and writing. It's not pleasant. It's not very accessible. Okay. The information that these documents hold are vitally important, but they can be off-putting and very laborious trying to process it. And I think that's what makes it difficult, because the truth is, if that is a requirement, you just get on with it. Similarly, oh, we're told we don't have any access to patients. Well, guess what? There's a way for me to get access to patients. There's a way for me to even get access to information from research other people have done, because honestly, it's exceptionally rare that you will work on a project that no other human being has ever worked on the entire planet, ever. Like, there will be some information about it somewhere if you look hard enough. So desk research can be invaluable. So I don't really think it should be that hard dealing with policy and regulation. I just see it as just another, even a constraint is a bit hard. It can be a constraint because of its complexity, but you just get on with it. I think it's also important to keep in mind is that normally UX professionals are not going to be the expert on the most complicated policies and laws at play. There will be somebody from governance, legal, that will know this stuff. And almost always you should be having an independent review of your work as well. So don't do this on your own. If you're not an expert on this stuff, why are you pressuring yourself to do this on your own? Get the help from others. But if you haven't done it before, it will feel daunting, but it's not as complicated as it feels. As long as you are making sure that you stick within your lane and get the support from people that do know more on these matters.
Yeah, and I want to jump in and remind people that when we wrap this up in 10 minutes or so, we'll make sure we ask each person on the panel how we can stay in touch with them and how you can join Gyles's clinical UX org, because we have someone in the chat who sounds like they could use a little mentoring on some research they're trying to do. But we have so many questions and only another 10 or so minutes. So I guess quickly, Jack or Cherish, anything you want to add to Gyles's answer about balancing policy and legal and stakeholders with being more user-centered?
I can jump in really quickly, which hopefully will give time for Jack. I guess I'm in a really privileged position whereby, because we're recruiting for research, if it's almost not user-centered to start with, we don't get the buy-in, the research fails. So actually the policy, product, legal stuff has to fall in line with what is needed at the end anyway. So yes, as Gyles said, we do have to go for this very laborious process of going through lots of text heavy documents to get it up and running. But if we go get it started, it's not working, people aren't buying, we have to go back and say, this is what people want, it's your money, if you want it to work, we need to do this. And they generally say, okay, as long as we're not putting anyone at harm, we'll give it a go, and it's good justification.
Thanks.
Yeah, I think I was just going to say, David, just very quickly, I think it's been covered up perfectly by Gyles and Cherish there. But to Gyles's point, it's knowing kind of what you're working with, knowing the regulations, knowing kind of policy around that area. Of course, there's always going to be room for independent reviews, to have people kind of review that and make sure that you're adhering to the correct guidelines that you need to be. But ultimately, once you have the user evidence, it's very rare that you're going to be able to meet every single need that you find from around a user research, for example, with your products. But you need to make sure that you're covering off the kind of priority needs, the things that are actually going to help solve the problem that you need solving, basically. And obviously that takes a lot of knowing, as I said, through knowing those policies, knowing those regulations, and knowing what you can actually achieve, and being realistic about that, and not trying to kind of boil the ocean, so to speak. So yeah.
Thanks. A question that's come up in the chat room as well is, what is the most challenging part of this job? And I think I want to start with Cherish, if you feel ready to answer what is most challenging.
Again, this might be slightly off from my perspective. I'm in this weird paradox where I do research on research, right? But I'm a product of what I'm doing. So I have to be so reflective and sit there and ask myself questions. And I guess the most challenging thing I have to ask myself is how can I better my practice, and what should or shouldn't I change within the process of what I'm doing based on the feedback I'm getting, because I'm in this peculiar paradox. So it might be a slightly odd one, but that's just where I find myself a lot of the time.
Behavior change for the behavior changer.
Yeah.
Okay.
Absolutely.
Jack, something to add to what you find most challenging in your universe?
Yeah, it's things that I mentioned. It's sometimes the pace, and it's sometimes the constraints that you're operating under. Again, it's for good measure, because we're dealing with safety, patient safety. Everything needs to be clinically above board, and so it should be. But it's just managing those and being able to still provide value with your product or solution under those kind of set of regulations and guidelines. The other thing that I think I will come up against plenty of times in my career is some of the kind of interoperability of softwares that are being used, and maybe the lack of it. I know, obviously, Gyles is a former practicing clinician. There may be others on this call as well. I don't need to kind of preach to you about how interoperability or lack thereof is actually preventing a lot of innovation within the digital health space, I think, and also really contributing to poorer outcomes in healthcare. So things like interoperability and kind of understanding what you can do again is a bit of a challenge within the kind of technical constraints of what you can do, because ultimately you will always be able to design something that fits user needs, that is really great, has all the features and things that you think it needs to do. Whether you can actually bring that to reality often doesn't always fit. So that can be quite challenging to kind of come to terms with sometimes, and a bit frustrating, but it's definitely a challenge that I've noticed kind of throughout my career so far.
Thanks. Gyles, something to add to that?
Yeah, I think a more unique one, and it's an issue for many UX professionals, especially I think the more senior that you get. And it's this general poor understanding of a lot of people have of what a UX professional does. Our work can be trivialized. Our work can be seen that it can be done by non-trained professionals. It can be seen as easy, and this is extremely dangerous, particularly in
Right.
my
You're just
field.
talking to people, right?
Especially in my field of healthcare, when we rely on assumptions and cut corners, literally people are harmed and die. I've seen it even as a clinician, not just people working in digital health who don't know. So people who are already trained professionals specializing in providing healthcare services, them cutting corners, them not listening to people, understanding the motivations that's driving people's behaviors, leads to harm and death that is completely avoidable. So it's made me have to be humble. It's made me have to be patient, but also have a strong passion, a ferocious passion to bring change. It's a big reason why I encourage others to enter this field if they dare. But to gain that deeper understanding when you're working in healthcare, so that you can do something really impactful, to really combat those issues of people not understanding what we're doing. That's why I also do a lot of strategic work, so that there is that much more informed decision making that leads to the best outcomes for the general public as possible.
Thank you. I don't have my applause sound on today, but thank you so much for, obviously the three of you, all the great work you're doing. I think a good closing question comes from Ana Lucia, and then we'll ask each of you for kind of a final thoughts and how to get in touch with you. Ana Lucia, friend of the show, says, from my experience, the healthcare industry does impose quite a few restrictions, and it ends up being quite difficult to try to influence change. Clinical UX is definitely needed. My question is, how can one start in this area when it seems there is resistance to change, or may not even be aware there's a need for this area? How do we get started in this? Anyone?
So talk to me is definitely a first point of call. Please do reach out. There's a variety of ways that I support people in this one, whether it's just advising on what sort of role that you should be going for, because you don't have to improve the experience of patients and clinicians by working as a clinical UX professional. There's many other roles that can impact that. In fact, there's a lot of other roles that have the most impact at the moment, in politics, for example, in management within the healthcare industry. The Clinical UX Association is now become a professional body for people working in clinical UX. So you can find out more information by going to clinicalux.org. We're going to have a launch event on March 21st. For those that are listening live, you'll hopefully still have time to attend that. So just go to clinicalux.org to find out more information. But I think the most important thing is, if you know that you want to be making a difference, make sure that you do actually bring some skills and knowledge to make a difference. It can't just be passion. Because even when I remember changing careers from medicine and getting into UX in general, I didn't have a lot of UX skills. The whole problem solving mindset and certain techniques for medicine was very transferable, but I never knew about prototyping, never knew about the whole concept of service design, having to learn about other research methods beyond interviews, observational studies, and I suppose desk research that does come up when you're an academic. I didn't know these. I had to learn this. For me, it was doing a master's degree. Some boot camps can be useful. Many can be problematic. Please be careful if you're going through a boot camp route. but definitely get some sort of formal education. What I mean by that is structured teaching that teaches you something that you wouldn't have easily have learned on your own. I think if you try and go on this journey completely on your own, you're going to struggle. I've had and still have many mentors, formal education to get to the place that I'm at, so that I can even also confidently then teach, train others as well. So yeah, please reach out to me. You can find me Dr. Gyles Morrison on LinkedIn, clinicalux.org. There's going to be a whole host of events and resources for you there as well. But also, if you haven't already got some sort of formal education in UX, I highly recommend that as well. I don't recommend a Google UX course though. But
No,
Debbie
me
has a
either.
wonderful video that can explain that if you look at our archives.
That's right. Go to YouTube, right? Delta CX Google UX course, and drink water every time we say it sucks. And also, quick reminder before we get to our other two peeps to ask them, how do you start? Next week, for our webinar next Wednesday, we also have a hand-picked panel by Dr. Gyles Morrison. So please come back and meet some more people in that healthcare and behavior sphere. So let's go to Jack. Jack, how do you suggest someone get started in a job like yours?
I suggest focusing on the skills that you do have, because I think one thing that I always did when I first started out, which I maybe would have flipped around in the way that I looked at things, was focusing on the skills that I didn't have. So I was looking towards the kind of UX sector or UX skills and thinking, well, what don't I have? Do I need to be doing prototyping? Do I need to be learning this, and this? And I kind of forgot about the skills that I did have from formal training, such as academics. So psychology background, I was naturally better placed to have an understanding of research methods, human behavior, things like this. I did health psychology, therefore I had a bit more of an understanding of kind of principles within healthcare. So use things that you do know, and just remember what you do know and things that you do have expertise in, and then try and identify, okay, well, how can I kind of build on that around UX? What do I maybe need to learn that I don't have, and how can I learn that? It's about just framing it in a more positive way, I would say. That definitely is something that I would have changed. Formal training, as Gyles mentioned, is always great, the right type of formal training. And I don't think it can be overstated how important self-study is as well. There's a lot of information out there. Relatively to other industries, UX is still in its infancy somewhat. However, there is a breadth and a ton of information online about UX principles, many kind of free resources as well that you can lean on, and just kind of piecing together what you do, what you think you need to know, and what those core skills that you need to develop. I think it's very, very useful as well.
Thanks. And Cherish, any other additional tips on getting started, especially in maybe your academic world?
Yeah, it's very similar. I think Gyles and Jack have just summarised it perfectly. I don't really think I need to add any more. Formal education into ongoing CPD. Yes, I went down an academic route, so I started working initially for the NHS and then the University of Southampton, where there's universities are a hive of research. So if you want to go down an academic route, that's where you really want to be looking. And if it's okay, just quickly, I wanted to come back to Anna Lucy's ask about how to start in the area when there's resistance to change, and I can speak to that personally from some recent experience. And I guess just a bit of a tip, really, you need to find evidence that really speak to the stakeholders you're trying to engage, and don't assume what you think is engaging is what they find engaging. So some people like numbers, some people like quotes, some people like in-depth case studies. Some people want their friends to be bought in first, so get a bit of peer influence going on there as well. So yeah, I just wanted to finish with that.
Great, thank you. And so that we're just about out of time here. We try to keep these around a half hour, but they always end up bleeding into about 45. So I want to give everybody one last chance for anything they want to mention, and of course, how we can get in touch with you, whether you're open to mentoring people. If you're selling something, I do let people plug something they're selling. I get no piece of it. Hashtag not sponsored. So we'll probably go with Gyles last, since he'll have a few things to tell everybody about. So Cherish, how do we find you?
I think the easiest and best way is probably through LinkedIn. Fortunately, I've got quite a distinctive name. So if you put Cherish, spelled Cherish, Boxall into LinkedIn, you'll find me. Feel free to ping me a message. My job's talking to people and I love it. So yeah, if you want to reach out and have a chat and a drink virtually, that's fantastic.
Yeah, and I always like to spell everybody's name. So that is Cherish, last name B as in Bravo, Oxall. And now, Jack, I'll spell you and let you tell everybody your thing. JackBurton. Go for it.
That's it. Exactly the same as Cherish. I'm most active on LinkedIn. So if you want to drop me a message on LinkedIn, my door's always open. If you want to chat, great. If you want to kind of meet for a virtual coffee or a coffee, if you're based in London or somewhere else in the UK that we'll both, where we can both cross paths, then yeah, let's do it. But LinkedIn is probably best for me.
Great. And I will spell Dr. Gyles and then give him the floor for a moment. So, of course, it's Gyles, Gyles, Morrison, Morrison. I always spell his name wrong. I always put too many S's in there. So one S, everybody. Don't be like me. Gyles, what are some final words and how people can find you?
Yeah, this is a great field to work in, clinical UX. Even just being in the healthcare side, everyone talks about making a difference in people's lives. It makes a difference in your own life as well, to be honest. It's a really heartwarming industry to work in. It doesn't mean it's not without its faults, but I can't think of a better career to be working as a clinical UX professional. So if this is something that you're interested in, again, you can reach out to me. I give away time freely to people, so you can find me on LinkedIn. Just search for my name. Definitely, you can also find out more about getting into the field of clinical UX by going to clinicalux.org. We're having a launch event, as I mentioned before, for the CUXA, that's Clinical UX Association for short, on March 21st. It's 6 p.m. in British time. And there you'll be able to find out more about our plans for the months, years, decades ahead, and be able to keep in touch with the regular ongoing work that we're doing. So resources, white papers, podcasts we've got planned for as well. So really exciting times ahead.
For sure. And as always, we wish all of you all of the success, especially with Dr. Gyles. And I can't stop calling you Dr. Gyles. I'm so sorry. Out of respect, Gyles, and probably Dr. Cherish as well, I would imagine. So sorry, there more titles. But thank you again to everybody for agreeing to do this. I know we've been planning it for a long, long time. I'm so happy to see it's finally here. And I hope people will join next week. That is next Wednesday, March 6th at the same time. Yes, the same time. Oddly enough, I accidentally booked 2 webinars next week, so don't mess it up. The 3 p.m. Italy time one will be the continuation of this with some other panelists from healthcare and UX. And then the 11 p.m. Italy time will be design and strategy and leadership with Jeremy Miller and Michelle Packran. So I did that. So thank you to everybody again. I'm going to stop recording and I hope to see everybody again soon.
Thanks, Debbie, and thanks, everyone.
Thank you.